name is Dr. Mustafa Sulemanji. I'm a neonatologist partnering with Ponea Health, and we are talking about sepsis, neonatal sepsis. So what are the risk factors of sepsis? Well, depending on the type of sepsis, because we have two major distinct types of sepsis that we talk about when we specifically talk about neonatal sepsis. We have what is called the early onset sepsis, which means that it happens very early after birth, and we have what we call the late onset sepsis. So the early onset sepsis usually happens because of an insult or an event that either took place before your baby was born or during the time of birth. So if your baby picked up a microorganism or a bug during the course of delivery or prior to delivering your baby, then that would be identified as early onset sepsis. And obviously the baby will show a completely different kind of character or signs when we are assessing that baby. When we talk about late onset sepsis, this is sepsis that usually occurs after about a week of life. And these kind of sepsis are mainly due to an infection or a bug or a microorganism that the baby has actually acquired during the course of life. So it could be because your baby had maybe an IV line or an invasive procedure being done to the baby that potentially passed on a microorganism to your baby that then caused sepsis. We know from our clinical practice that we really fear the early onset sepsis, and hence you will notice most of the times when your baby is born, and if the baby shows any signs of suspected sepsis, the doctors will not hesitate in starting your baby on antibiotics right away. And that course of antibiotic is usually termed as what is considered as rule out sepsis management. So we will start antibiotics right off the bat, and then we will obviously assess the baby and send some blood markers. And in response to that blood results, if we feel that, okay, your baby does not have sepsis, then we will discontinue those antibiotics. So a lot of mothers will have this lingering question. My baby was just born. Why did this doctor immediately put this baby on antibiotics? It's more in relation to playing and being in a safer zone, because early onset sepsis can actually be very lethal. If we miss it, then it can really have very fast and very bad outcomes. How can I monitor my baby at home? If your baby has sepsis and you've delivered your baby, you've gone home, and we are now probably dealing with more of late onset sepsis, or even if it's within the first week of life, then are there any signs your baby will try and show that can potentially make one suspect that your baby has sepsis? Well, the easiest sign that the sign that most mothers will pick up very quickly is the baby's general activity level. Most mothers will come and say that my baby is sleeping too much. I cannot wake my baby up. The baby is listless. And that is actually a very critical sign of suspicion of sepsis. You can have changes in the skin. So you can have mottling, what we call a skin that looks like a giraffe skin all over the body. You can have tiny red dots all over the body. A child who's got sepsis can also look a little more yellow, can look a little more pale. So that can potentially make you suspect sepsis. A child with sepsis can have breathing problems. A child who has sepsis can potentially have a very low fever value, a very low temperature, or can have a very high temperature, so probably a fever. A child with sepsis will also tend to lead towards not passing enough urine. Hence, suspecting or triggering any suspicion of should I be taking my child to the doctor. But, the activity and the poor feeding are one of the early markers of or early signs of someone to suspect that the child may have sepsis. Thank you for joining us for this discussion today. You can book for our services at ponea.com, and I look forward to seeing you soon.